Good morning, respected chairpersons, distinguished delegates. At the very outset, I wish to thank the organizer, NAPCON 2021, for giving me this opportunity in this workshop to talk to you about role of respiratory allergy clinical diagnosis. My best wishes from all the institute where I have worked. This is King George Medical University, Lucknow. This is SAIFAI. Now it is a medical university. Then I worked as director, VALLABH PATEL Test Institute, Delhi, and currently I am working in ERA's Lucknow Medical College, Lucknow. My objective for next 18 minutes would be to what is the significance of history and clinical examination in diagnosis of allergy, particularly the respiratory allergy. I would start my presentation with this publication on a study of prescription habits of medical practitioners regarding allergy testing, which I did when I was in King George Medical University. What we did, we studied the 125 doctors who referred their patients for allergy testing. You can see from this slide that around 60% were postgraduates who referred, even graduate allopaths around 25%, and about 15% even non-allopaths. They also, so allergy testing has been very popular. And the various diagnoses, what they have mentioned was allergy, asthma, rhinitis, skin allergy, food allergy, drug allergy, ocular allergy. So people are referring for allergy testing. But when we worked with those 125 patients in our allergy clinic, what we found that only 70% they were suffering from allergic diseases. Other 30%, they are not having any allergic disease. And what are the common non-allergic diseases where doctors have referred for allergy testing? You can see in this slide, even common cold, COPD, tropical pulmonary eosinophilia, bronchiectasis, even skin scabies like psoriasis. So people are less aware of what is the role of allergy testing. And distribution of various allergic diseases where they have really advised was bronchial asthma and rhinitis and urticaria. So these are three common diagnoses. So you can understand that nasobronchial allergy is a common problem. But only to our utter surprise, whosoever have been referred for allergy testing, only about 54% they really required allergy testing. So in this study, we have concluded that out of 125 patients who were referred for allergy testing, where allergy testing was definitely indicated in half of them. So that you can see that majority of the medical practitioner advised for allergy testing, but the actual need for it was far less. So with this publication, I would like to start what is allergy. And by this time, you must have understood what is allergy. Allergy is human intolerance to environmental factors and human immune response which give rise to irritant and abnormal reactions. For the first time, the Von Pirquet defined allergy, the ability of animals and humans to develop altered responses to foreign substance after repeated exposure. There's another word which one should know, that atopy. Atopy is genetic susceptibility to develop IgE against common allergen encountered in the environment. In 2004, the atopy was redefined as atopy is a personal or familial tendency, usually childhood or adolescent, to become sensitive and produce Ig antibodies in response to low doses of allergens, usually proteins, and to develop typical symptoms such as asthma, rhinoconjunctivitis. So atopy is atopy means person is more exposed to develop IgE mediated allergic diseases. What are the various allergic diseases which comes to in our day-to-day clinical practice? You see asthma, rhinitis at the top. That's what we also call it as nasobronchial allergy. Could be ocular allergy, skin allergy, food allergy, even anaphylaxis, drug allergy, insect. So many allergies are known. What are the allergens? Allergens means which are those substances which cause allergy. Now, allergens could be inhalants, could be ingestants, injectants, and contactants. Any sort of this, like pollen, fungus, various type of dust, dust mites, foods and food additives, drugs, insect bite, medicine, oil, silk, anything can cause allergy around us. But the common, in our many of the studies we did, we found that common allergens are usually house dust mites, insects, pollens, fungus. These are the common allergens. Another thing you have to understand is the what is pollen calendar. Pollen calendar means if the pollen is of interest, and when they pollinate, that is known as pollen calendar. Pollen calendar has been prepared in this country from state to state, and you see this slide. This yellow is maximum, means yellow means this is the beginning, and this is the peak season. Like I'll take example of as a director, which is also known as neem. And neem pear you have seen, and it pollinates in month of March. So its pollen calendar you have to know. Like you see, this is a neem tree, and you can see white flowers around the neem tree, and photograph was taken in the April, so that was the pollen calendar. This is another common allergen, what we call it as ricinus, and that pollinates in February. So the pollen calendar, of course, becomes February, March. So with this little bit of background, how to diagnose allergy? To diagnose allergy, you require history and physical examination, and then you require lab test. And in history is very important. My today's job is to talk about the clinical history. Clinical diagnosis will take history and physical examination. Now, clinical diagnosis of respiratory allergy, nobody can dispute the history taking. History, we always tell that even for any disease, history is very important. Even we say that 80 to 85% of the diagnosis comes from history. This is more true for allergy patients. So importance of adequate and careful history is well known. History is directed mainly towards establishing underlying causes. And so I always say that this is a specialized history, and naturally it consumes time. Usually a good history takes about 30 to 45 minutes. I always say that you have to work like a CBI detective. So find out that whether person has allergic disease. So our objective while we take history is whether patient has an allergic disease, one, and then it discovers underlying causes. To diagnose allergic disease is not very difficult, but to discover underlying causes, it takes time. So, how to find out whether your person has allergy in the background? Like there are many patients of rhinitis, there are many patients of asthma, they may not be allergic, but how you suspect that allergy is really a issue in this particular patient. So there from history you find out the onset of that particular disease would usually, if it is allergic, is from childhood. And then usually you find that family history is usually maybe positive of various allergic diseases. There are usually combination of symptoms. You know, all of you know that if person is having bronchial asthma, it is also associated with rhinitis. Even sometimes it may be also associated with skin allergy. So combination of symptoms may be there. And then there could be a seasonal variation depending upon the allergen, especially in the pollens which are seasonal, there the variation of symptoms would be seasonal. And there could be geographical variation. When I say geographical variation, geographically change from a long distance. It is not between Delhi and Ghaziabad, but geographical changes will occur between Delhi and Srinagar, Delhi and Bangalore, when fauna and flora changes. So many patients, they come to us and they say that if I live in Lucknow, I have no problem. If I go to Bangalore, I have a lot of allergic problem. So that's what is geography. So if you get these five things, then you may suspect, yes, the person in front of you is having a allergic background. Then you have to, in the history, you have to go as you take history from any patients. Here also, you have to take in detail. Chief complaints will be mostly localized to nose, eyes, chest, skin. Then you have to go present illness details, duration of illness, age of onset of disease, nature of onset and severity, and the symptoms at onset. Everything you have to record it down. Then details of the chief complaints as you take in any patients about the wheezing, about the nasal congestion, and then concomitant presence of atopic eczema in child and lower respiratory tract symptoms suggestive of asthma. So history, what I'm trying to say, you have to go in detail. When symptoms occur may be very important. Suppose it is seasonal, it means pollen. If it is perennial, there are many things which are perennial like house dust mites, animal dander, molds, cockroaches, and it could be regular and it could be perennial with seasonal exacerbation. Time of the day and location when symptoms occur may be very important. If attack occurs in the daytime at workplace, it may be occupational contacts. In night time, articles in bedroom may be important. At playtime, something near the playground may be important. And during house cleaning, of course, the house dust would be very important. So that you have to take in detail in the history. Various precipitating factor which precipitate these symptoms. Maybe we have to go into depth of it. Like it may be pollen, dust, animals, food, oils, any insects, psychological factor, and even physical agents sometimes may create change in the symptomatology. Clinical, thorough environmental history is also very important and relevant to symptom is very important. And these things you may not be able to discover by any test. Assessment of impact of illness is also important. Number of the lost days from work, social adjustment, limitation of activities, presence of nocturnal symptoms, frequency of unscheduled physician visit, emergency department visits and hospital, everything you have to record. So actually cases, what is usually done with allergy patients are very detailed and special cases are prepared in most of the allergy clinic. In the past history, you may start that some disease in infancy and childhood, especially the atopic diseases, may be very important. Many of the asthma patients, they tell that during my childhood, I had suffered from eczema, I had suffered from rhinitis. So any vaccination history, ENT operation, any, and previous history of drug intake and their response, especially if any drug has caused adverse drug reaction, allergic reaction, that you have to record it up. Family history, I have already talked to you that genetics is an important component of atopy. Predisposition to allergic disorders would be 30% if one parent or sibling is atopic. It could be 50% if both parents are atopic. And it could be 13% if neither parent. So it is not necessary. So absence of family history should not exclude the allergy. But if you get family history, then chance of allergy is very high. Personal history like present job, past occupation, job at onset, hobbies, diet, home conditions, smoking, active as well passive, everything you have to find it out. Then finally, after a detailed exhaustive history, you have to go to the physical examination. And of course, complete physical examination is mandatory. Specific attention that should be directed to the areas where allergy occurs, like nasopharynx, conjunctiva, lung, and skin. And you should also remember that there is no finding or minimal finding when patient is asymptomatic. Like somebody comes and says that I have urticaria, I have breathlessness. At present, he may be in remission. So that you have to always keep in mind. So finally, ladies and gentlemen, I have come to end of my presentation. Now you have understood that the clinical diagnosis of allergy, respiratory allergy is very important and it needs good amount of time to complete workup, history and physical examination. I have said, I'll repeat that usually special cases are designed for most of the allergy clinic. Careful history discovers underlying causes, and I always say it is etiological history rather than diagnostic history. It is very easy to diagnose asthma when patient enter your clinic. But whether it is allergic, not allergic, what are the other factors responsible for allergy? For that, we call it as etiological history. For that, even knowledge of aerobiology, pollen calendar is also very important. I always say that allergists want to become, you have to become fauna and flora around you. Physical examination usually confined to those systems where allergy may happen. And I always say that no test alone is diagnostic. So always your history should be correlated with the all other tests, including skin tests. So ladies and gentlemen, I have come to my end of presentation and my take home message is adequate clinical history, detailed clinical history, and physical examination is very important for diagnosis of respiratory allergy disorder. Thank you very much for very patient listening. And if you have any query, I love to answer that. Thank you very much.